Right, and thank you everybody for joining us for this video. We're going to be talking about what's happening in the rollout of the governor's rollout back into doing business in terms of job hazard related issues, legislation, and safety as it applies to workers as we start going back to work a little bit at a time. I want to, first of all, I've got to thank Jim Jones and AACS after, I guess, after 15 weeks of Sunday night Zooms with Attleboro, which from what I've heard were very much appreciated. An awful lot of people watch them. He and his staff, who are professional beyond words, do an awesome job keeping the city involved and aware of things going on with different leaders from health, from public safety, from workers, from businesses and so forth. And this is just one more. I've got to say, this is the first time I've been as a moderator, which makes me a little nervous, but he's done all the work to make this flow smoothly. There's still some people joining us. We have right now, we have Senator Feeney, who shares a good part of Attleboro with me, who is a good partner to work with. We share a lot and we get a lot of things done together. We have Jim Redmond from NAGE. We have Chrissy Lynch from AFL-CIO. Jim Pimentel just joined us. He's from the Bricklayers. And there may be a couple more. This is just 7 o'clock. We're just signing on. This is, for most people, this is the end of a long day with a lot of Zooms. So I appreciate all of you for being here with us. I'm going to let Senator, I see I'm the only one with the list of the order here, but if it's all right, I'll have Senator Feeney talk next. I think what I'll do is go through. I'd like to keep it to an hour because I think that's about the limit of everybody's attention span. So maybe if everybody could take, and the people who are on are coming from a variety of different sectors from the economy. So there may be some shared things, but you'll probably each have a little different angle as to what we should know about workers in this evolving situation. So I'll let Senator Feeney go next, and then since you don't have the list, I'll tell you who's after that. Thanks.
Thank you, Representative. It's good to join you tonight. I just want to echo your sentiments about Jim Jones and AACS. You know, in Attleboro, we've been doing these weekly Sunday night calls with City Councilor Todd Kovas, and really just doing as much as we can to get information out to people throughout the pandemic on a host of issues. Obviously, number one, the public health impact that we've been facing as we kind of came up towards the surge, and now as we try and manage a pandemic that's still out there that we still need to remain vigilant on. But one of those issues that you and I, Representative Hawkins, have been working on, for a long time now has been around worker protection. Understanding that, in a pandemic, we found out awfully quickly that, you can shut down certain sectors, but there are a lot of workers that had to continue to work. They didn't have the choice of working from home. They couldn't be in the comfort of their own, living room doing Zooms like you and I are, 14 hours a day. They had to go to work. And, what was a very kind of discrete group of workers early on, obviously we talked a lot about firefighters and nurses and police officers, grocery workers, right? We dealt a lot with the United Food and Commercial workers who had folks that had to go to work, people in the service sector, folks that were within the DDS world and going and taking care of people that are most vulnerable in our community. So, we started to have these conversations about presumption language. And I know we're going to talk a lot about that tonight and kind of dig into the details of what that means. But then as we started to roll along, we said, it's not just one group of workers or another. It really is workers across many, many sectors that are put in harm's way because they have to go to work. And now as we get into the reopening, we went from kind of triaging the folks in the emergency and the frontline people that, had to work from day one. And now we're starting to see a reopening of the economy. And we know that the virus is still there and it still exists and people are still in jeopardy. Workers across the Commonwealth in many different industries have to face this. So now as we expose more people, as we expose more workers, we're having these conversations in the legislature and with all of the folks that are on the panel tonight to figure out, what can we do to best protect workers who have to go to work, and potentially expose themselves to this virus. So there's all sorts of different kind of offshoots and It's a kind of a nuanced problem in each sector as far as the rate of exposure. But obviously we want to do everything we can to protect workers. So I look forward to the discussion tonight. Everybody on this call, he just does incredible work in representing their own members and workers across the Commonwealth. And I look forward to the discussion. I want to thank you, Representative Hawkins, for putting this on. And I look forward to, figuring out, first of all, hearing from folks and what the experience is on the front lines, and then really trying to strategize and figure out, how do we kind of build momentum around this idea that if we're going to put people in harm's way, if we're going to send workers out there and potentially expose themselves, then we got to make sure that we're protecting them as much as we can. So thank you, Jim.
Thank you, Senator Feeney. Jim Redmond is from the National Association of Government Employees and one of the most professional people on the Hill. So I'm glad that he's on this call with us. So Jim, you're first in the list if you want to talk a little bit about your side of it. You got to unmute yourself.
There we go. Can you hear me now? Thank you, Representative, for the kind words and for the invitation to join you tonight. I echo a lot of the sentiment that Senator Feeney touched on, in his opening comments, and I think it's a testament to both Senator Feeney and yourself that three of the sort of core bills that NAGE has focused on since the beginning of the COVID-19 crisis, you are lead sponsors for two of those three bills. So I thank you for that, and I thank you for your work in advocating for those bills and for the members who will benefit from them eventually. I think, in our experience, I think everybody's experience, the first days of this situation were sort of chaos, and I think people were kind of grappling with getting through the day to just figure out, what we were going to do from day to day, and which of our members were getting called into work, who was able to work from home and telecommute, which workers were just staying home because they couldn't telecommute, but they also couldn't go into a work environment, for the foreseeable future. So it left a lot of it created a lot of confusion, a lot of chaos, a lot of fear for our members. And as the legislative director for NAGE, what we tried to do, working with folks like Senator Feeney and yourself, Representative, was to look at, what was the best way we could protect our members and what did we need to protect their health and safety, and how could we make sure that the people that were serving on the front lines were being adequately protected and also compensated for the work that they were being asked to do. So, we've been working on three bills. The first bill, I think it was one of the first bills filed, Senator Feeney, correct me if I'm wrong, which would have created a sick leave bank for state employees across the Commonwealth that did not have enough time, that became sick with COVID-19, that we're actively working on. Another bill, the second bill that NAGE filed, created hazard pay. We created a hazard pay system or a comp time system for all public employees across the Commonwealth. So it wasn't for folks that were working from home, but we really wanted to focus on the population of employees that were continuing to keep the lights on in Massachusetts, that were showing up to a work location. In our situation, be it the Registry of Motor Vehicles, the Department of Corrections, showing up at a correctional facility to keep things running, the trial court, keeping the trial court staffed, even at a skeleton level, but just keeping things running. So we worked with Representative Taki Chan, and we filed that legislation. And I think we filed that just as a testament to the interest and the support that we got from the legislature, with over 60, maybe north of 70 co-sponsors when we first filed that. So, and obviously the big issue that I think is on everybody's minds is, looking at the budget for next year. And we have a hole that really hasn't been defined yet because we're still waiting for the federal government. The House Democrats took a huge step in early May by passing the HEROES Act. And we're still sort of waiting to see what the negotiation is going to be with the Senate. But that's something that we are actively lobbying and working and supporting, because a lot of the things that we're trying to do at the state level are going to be dependent on what the federal government does and what they come through with. And then the final local legislation that we have been really trying to put some muscle behind is a bill that you filed with us, Representative Hawkins, to create a presumption for all public employees who meet that criteria of the first bill, reporting to a site outside of their home, serving at a work location, and continuing to interact with the public and serve the public. We create a presumption of for COVID-19. If someone were to get sick, and if someone ultimately succumbed to COVID, their family would be eligible for a survivor pension and what we call a Section 100A benefit, which is awarded to police and fire primarily if they're killed in the line of duty. So, we've really tried to see what's the best way that we could, advocate for our members on Beacon Hill and in Washington, to continue this. And as we start to reopen, it's important that we make sure that our members are going back into a safe place and that we have protocols in place to protect them. And our field reps and our leaders, our state presidents have been working really around the clock since March to try to ensure that our workplaces are as safe as they possibly can be, and to make sure that people who have an opportunity to telecommute can telecommute and continue to telecommute through this time. So I know we have a lot of people. I don't want to talk too much. I'm happy to answer questions and engage on some of the things that we've highlighted, but I hope that's helpful as a starting point.
Perfect. I think we'll leave time at the end for questions if there are any. And I'll also offer, that's a good point. There's a whole list of people on this conference, all of whom I have close contact with. So if there are questions that you want to find out afterwards, you can contact me. My cell phone, my personal cell phone, so we don't play telephone tag, is 508-226-1436. Or my email is james.hawkins@mahouse.gov. Either way. So if you have questions for any of the panelists afterwards, and I'll repeat that at the end, you're welcome to contact me and I'll reach out to them. Next in the sequence would be Chrissy Lynch from AFL-CIO. And AFL is another wonderful organization that looks out for working people. So thank you, Chrissy, for joining us.
Great, thank you for having me. And I want to just echo Jim's sentiments. Certainly Representative Hawkins and Senator Feeney have been huge allies regularly, but especially during this time as we've all been scrambling to figure out what the right solutions are. I'm going to kind of keep it a little bit top level and just sort of what we're seeing from an overall working people perspective, both public sector and private sector. I mean, these are unprecedented challenges, and they're really laying bare how intertwined public health and the economy are, and how absolutely vital working people are to keeping every family safe, secure, healthy, and fed. A lot of the people who really went unseen, and really the most vulnerable and low-wage workers in our economy in particular. It's also shown how critical economic safety nets like unemployment insurance and sick time and workers' compensation are, and how critical investments in the public good are to our entire Commonwealth. We can't operate on a shoestring budget and be prepared for crises like these. Essential public workers and private workers, they're on the front lines and they deserve, we see a lot of signs and billboards and commercials about calling them heroes, but they actually deserve much more than being called heroes. They deserve some kind of a essential workers bill of rights, especially as the economy starts reopening, and thinking about those who have been on the job for the last 3 months, putting themselves and their families in danger every day. They need hazard pay. As Jim Redmond mentioned, there's been a couple bills filed. There's been one for public sector and one for private sector. Workers need as much paid sick time as needed to care for themselves or a family member. There have been a few bills filed around that that do a number of different things. There needs to be a presumption, as Jim said, that if a worker contracts COVID-19, they did so in the line of duty or on the job, so that they're covered by workers' compensation and paid for on-duty time accordingly. We're already hearing really tragic stories about workers who have been out there on the front lines of this for months, coming down with this and getting sick, and their employers saying that it was community exposure, that not that they got it at work. And that's just egregious. It's wrong. And workers need protection there. They need access to free healthcare should they or their families become infected. They need protection from retaliation so that they can stop the spread of this virus and whistleblow without fear of being fired. We all know, working in this movement, that regularly when employees speak up about unsafe working conditions, unless they have the protection of a union, they are very often retaliated against. This has been a problem for a really long time, and this pandemic has really exacerbated it. There's been a few bills that have some language around anti-retaliation protections, but nothing comprehensive. And we're actually, I'm working with the Mass Coalition for Occupational Safety and Health to look at ways that we might be able to file a more comprehensive bill to really tighten up that protection for every class of worker. Another really important thing is comprehensive data collection on the infection rates of workers. There was a bill passed, I think last week, around data collection, and we were able to get the bill amended so that they included occupation in it, which is good, but we also need any infections to be tracked also by occupation, but also by industry, and whether or not the person has reported to work outside of the home in the last 2 weeks prior to the symptoms. These data points are really critical, especially as we reopen the economy, if we're going to be able to properly identify new outbreaks and guide future responses to protect these workers and the public they serve when they're at work. Massachusetts is among the top states in the nation as far as the number of COVID workplace complaints into OSHA, which is the Federal Occupational Safety and Health Administration. It's Trump's OSHA now, and this administration continues to completely renege on its duties to investigate complaints, crack down on violations. It hasn't even issued COVID-related emergency safety standards. It's for that reason that the AFL-CIO actually sued OSHA to do its job and release a COVID temporary standard. Unfortunately, our lawsuit went to a court full of right-wing judges and it was denied. But it shows there's such failures on the federal level from this Trump administration. It makes it even more incumbent on Massachusetts to create strong, enforceable workplace health and safety standards so that workers have a reliable place to turn if they think their workplaces are unsafe. Right now, the way this reopening plan has been put forth, it's incumbent on the workers to report safety violations if they see them, either to their employers or to their local boards of health. And there are just really major problems with this. As I mentioned, we've already seen time and again before this pandemic, workers who raise concerns are routinely fired or retaliated against in some way by their employers. And what the reopening board issued was not enforceable standards. They issued guidance. And unfortunately, guidance is not mandatory and it's not enforceable. The other problem we have is that local boards of health, while well-meaning and doing what they can, they don't have the resources to handle this influx of calls. And with few statewide standards, it's very possible that each board of health could handle similar issues very differently, which obviously isn't good. And understanding how problematic this is, the posters that were put out by this reopening board, they don't even have information on it about who a worker should call if they don't feel safe. So the Attorney General's office actually created a hotline for workers to call if they don't feel safe, since they already have an infrastructure in place to receive these calls because they enforce the state's wage and hour laws. And they've told us that they've seen a record number of calls in the last few months about whether it's people who think they're not getting paid properly because of this, or they're not getting their sick time, but also because they don't feel safe at work. And unfortunately, the Attorney General has no enforcement authority over making sure employers are creating safe workplaces. So this hotline is great. It's a place for workers to turn if they know about it. But really all the Attorney General's office can do is kind of refer those complaints to the local boards of health or Department of Labor standards. And we really need something stronger than that. We're glad the reopening board acknowledged how important it is that people with symptoms stay home from work. But especially as we find ourselves in allergy season, we are baffled that it did not come along with the guarantee that nobody will lose their job or their paycheck and their ability to feed their families should they need to stay home because they're sniffling. We have an emergency paid sick time bill filed in the legislature, and I know Senator Feeney and a few others have filed bills that, around different groups of workers. But this pandemic seems increasingly like it will last into the fall, and workers will need a lot more protections, particularly job protections, if they can't report to jobs outside of their home, whether it's because of symptoms or because of a lack of childcare. There's a whole host of issues that could make it really hard for people to go to work like they want to. On top of all of this, one troubling thing we're seeing is the Chamber of Commerce is actually pushing to get legal immunity in case their employees get sick about going back to work, really going back to work in workplaces that have no enforceable safety standards, no whistleblower protections, no job protection if a worker feels ill and stays home from work out of abundance of caution. Legal immunity on top of this would give employers the green light to pretty much operate with total impunity. It would disincentivize them from taking the reopening guidelines seriously. And we really hope that lawmakers will reject this call from the Chamber of Commerce. Another thing from the Baker-Polito reopening board, and DESE just came out with its guidelines, and that's the Department of Education, Early and Secondary Education, and we're glad that they see the importance of safe classrooms and small class size, but we're very confused because at the same time that they're saying this, they're cutting school budgets and they're laying off educators and school support staff in mass, leaving schools with less ability to achieve physical distancing, perform the deep cleaning, and implement any of the health and safety measures that are required. We think that budget cuts and austerity measures are the exact opposite thing that we should be doing right now. They would only worsen the effects of this downturn and impair our economy's recovery, causing further harm really to the people who are already disproportionately impacted by this pandemic, people of color, immigrants, low-income communities, women. This whole crisis, we think, demonstrates why investments in the public good are so important. There are several ways to do that, to do it progressively. That could bring in, close to $1 billion, if not more, quickly. So we hope that the legislature looks at those options before making cuts that could really be detrimental and devastating to so many working families and so many communities. And again, we're so grateful for Representative Hawkins and Senator Feeney's leadership. We know how hard the legislature has been struggling both to adapt to remote virtual sessions and to figure out how to grapple with this whole new host of issues we're all dealing with for the first time. And we're grateful to be partners, and we're glad to be part of the conversation. And if you guys didn't hear, my son just yelled into my office that he peed in the potty, so that's pretty exciting.
That's a big moment, Chrissy.
Yeah, I know. I'm actually pretty pumped about it. So.
And I think it was right on cue, right when you mentioned childcare, and
I didn't cue that up, I promise. So thank you again for having us.
Thank you, Chrissy. Couple of things. You covered a lot of very important issues, and they are issues. And you're right, this is going to be going on for a while, for a year. So it's important that we step up to the plate. You were talking about data collection. And if I'm correct, the issue was originally they only had people's home address, so they wouldn't know if they were together from the same workplace. And your legislation is to correct that so it can be traced to where the virus originated.
Yeah, so there was a bill, there has been a couple bills. There was a bill that was bouncing around between the House and Senate that required daily reporting from hospitals and healthcare facilities to the Department of Public Health around infection rates, mostly by race and gender and ethnicity. So you can start kind of better tracking how different groups of people were disproportionately impacted. And we were able to get that bill amended to add occupation so that you could see where somebody worked. And occupation's a good first step, but we really need that additional data. If you could say occupation could be cashier. Well, cashier where? Is it a restaurant? Is it a retail store? Is it an office? If we're going to be able to identify new clusters, it's really important that we have additional information outside of occupation. We were also able to amend another data bill around long-term care facilities. And we were able to make it so that there's not only daily reporting to DPH of the patient infection rates, but also the infection rates of the workers and the caregivers, because we're seeing them come down with COVID at a very high rate as well. And those people are also mostly women, mostly people of color, the same groups that we're seeing really hit hardest.
The other thing, as a retired teacher, I'm glad you brought up education. I just filed a bill Monday to put a moratorium on MCAS. And I've certainly been pushing for some of the funding issues that go along with that. So I'm glad you mentioned that as well. So thank you so much. Next is Paul Jakes from PFFM. Firefighters certainly, I feel like I've been lucky because I can stay at home during all of this and not go someplace if I didn't think it was safe, because there's a crowd, and the firefighters and the nurses have to go in anyway. They have to go into houses where they know there's COVID. Never mind, they think there might be. So I'm very interested to hear what Paul's got to share with us as far as what's going on with PFFM. So thank you.
No, thank you, Representative Hawkins. Thank you for putting this together. Thank you, yourself and Senator Feeney for all the support that you give at the state level, but also on the local level where I work in Attleboro and where you represent. As you said, we're firefighters. We're on the front line of this pandemic. It's not disputable. I mean, we're bringing patients to the hospital and working with the nurses on the front lines of this pandemic and this COVID-19. We've been in support of many of the legislation that you've heard today that has been mentioned, and others. There's 196 COVID-19 bills that have been filed, I think, so far. So we're monitoring all those and have been in support of the ones that provide protection for our members. And when we say protection, we mean, like you've heard, if you're tested positive with COVID-19, been exposed to COVID-19 or incapacity to work because of quarantine of COVID-19, then you should be covered as a work-related injury. And we feel that, in other bills that are filed, but there's 4 that we've been focusing on. One of them is House Bill 2261 and Senate Bill 1485. They are both mirror image in the House and the Senate. They are thankfully currently in the House and Senate Ways and Means. So we're trying to push those forward. They provide presumptive for firefighters that if any of those things mentioned come down and exposed and come down with COVID-19, then you're protected under 111F benefits. So in summary, as we said, it's a work-related injury. There's also House Bill 4611 and Senate Bill 2602 that have been filed under the same concept, and we're trying to push those with Rep. Serio and Senator Moore. So it's been, the pandemic's not over. It's not going to be over for a while, and it's still going on. And we're still pushing that legislation forward and trying to, with your help and your support, Representative Hawkins and Senator Feeney, and all of the members of labor working together, as you can see with everyone on this call, to get legislation covered for our members and all members that are out on the front lines in whatever capacity. So there have been extensions filed on a lot of these bills, thankfully, to keep them in play. We at the PFFM, we have a petition out there, and we have over 25,000 signatures in support of those 4 bills. So it's growing daily, and we're just working really hard to get that moving forward. A lot of locals or firefighters are in different areas around the state are having to use their sick or vacation time, and they're not being covered by any type of presumptive. So, for example, in where I work in Attleboro, we're in a, I guess you call it a debate right now with the city on what coverage is really done for our members that have COVID-19 or been exposed or quarantined because of COVID-19. We do have grievances out there on that, and all the way up to what we call level 3 grievance. So we're working on that now. It's been quite a battle locally and across the state on this issue. So we're just trying to make sure that our members are protected, their families are protected, and God forbid if anybody passes away, any of our members pass away from COVID-19, that their families are taken care of. So if you could go on the website, the PF website, or the Attleboro Firefighters Local 848 website, we have petitions up there. Sign, share, and get this legislation passed for all of us.
Thanks, Paul. I can't wrap my head around how a firefighter could be in an ambulance with somebody and get COVID, or have to go into a house with his COVID, or be near a coworker who was exposed to COVID and have to stay home and have to use their vacation time, or maybe even not get paid. That just, I can't, you shouldn't have to, nobody should have to shoulder the weight of an issue like that they got just because they were doing their job. I can't. Well, we've had this conversation. You know that just makes my head spin that anybody would even question that. But unfortunately, it is an uphill battle, and we can't just let this go. We got to keep working for that.
Some of our locals, such as Attleboro, have language in their contracts already that covers infectious disease, but it's still an uphill battle because it comes down to cost, and everybody's worried about cost. So that's why we have to file, unfortunately, and fight this to make sure that we're covered.
Well, I come from the schools, and I've always felt that the schools have always been underfunded since I've been there. We don't have paper, we don't have books, we don't have computers, we've got windows that won't close, yada, yada, yada. But I would give up 5 teachers rather than see one firefighter have to carry the weight of that on his own vacation time or his own pay. You get it at work, we got to cover you. That's just, I can't. I'm sorry, I can't find any wiggle room in that. Whether it's in the contract or not, that's just a matter of ethical. If you got it at work, it's our problem as a city.
And Jim, let's just jump in for clarification for folks that may be watching. I mean, obviously we deal with these terms all the time. And Paul, you mentioned, that there are other presumptives that there are. Could you just real quickly kind of talk about, as a firefighter, what some of those presumptions are on the job? I know occupational cancer has been just the absolute, scourge of firefighters. We lost a local firefighter recently in the last couple of days in Mansfield who had a tough battle. And, but could you just talk about kind of what the other presumptives are, what exactly that means? And just as a little bit of commentary, it drives me nuts when people give you parades and say that you're heroes and then fight us on the back end when it comes to actually making sure that you have the benefits that you deserve, especially in the midst of a global pandemic. So just quickly on exactly what a presumptive is and what other presumptions you have on the job.
Sure. No, looking at the screen, it's you feel that's how you're all only talking to. So you assume that everybody knows the terminology you're using. So thank you. Good point. So we don't in the fire service, we don't have workman's comp. So we don't fall under a workman's comp. We fall under what's called 111F benefits, which is a presumptive. So we have, that presumes that we have either heart and lung presumptive, cancer presumptive, or in this case, a COVID-19 infectious disease presumptive, that it was done in the performance of our duties. So in the line of duty injury, like I said, a work-related injury. So these presumptives that we have provide, you don't have to use your sick time, vacation time. They provide all the time off through the 111F benefits as an IOD, as an injured on duty injury, work-related, so that you don't have to use your sick or vacation time. And then if, God forbid, with the Section 100 and the other sections underneath 111F, that God forbid, if you do pass away, that your family is covered and gets PSOBs, which public safety officer benefits, and things that fall into play that are paid out to your families to take care of them after you passed.
Oh, I forgot I'm the moderator. not used to this role. Thanks, Paul. Next in the sequence is Jim Pimentel, and Jim is one of the most, like everybody on the page, he's not the most active person on the page, but everybody on the page, including Jim, is very active in a lot of social issues. I think that comes with the territory, and Jim's one of the best. So I'm psyched that you're on this conference call with us.
Well, thank you, Jim, for those very kind words. And thank you to yourself and Senator Feeney for hosting this meeting and for your continued advocacy and support for working people in general. I can say, as an elected leader with the bricklayers, and maybe speaking more broadly on behalf of the building trades, fortunately, building trades members have not been hit as hard as the members of the other unions that are on this meeting and the leaders that are representing them. In terms of unemployment, a lot of jobs were shut down. Mayor Marty Walsh shut down the city of Boston on March 16th. Cambridge and Somerville followed suit. East Hampton out in Western Mass did about a week later. And there were some high-profile projects around the state where the owners kind of made the call and shut the jobs down temporarily, like Polar Park and Worcester. The Bureau of Labor Statistics had released the unemployment rate recently for the last month, and it was 13.3%. I think nationally in construction, we were about 12.7. So, in terms of being thrown out of work, we had our fair share thrown out of work. Of course, our members were able to take advantage of the unemployment with the extra pandemic unemployment assistance, the extra $600 a week. But in terms of actually facing, or contracting coronavirus cases, our members have fared pretty well. We thought that when Marty Walsh shut down the job sites in Boston, at least in the bricklayers, we thought it was a little bit heavy-handed, and he overreacted a little bit. As you know, Jim and Paul, there's a $260 million high school being built in Attleboro currently, which has faced little or no interruption. That project has continued to move forward, and work is being done as we speak. So we felt with some minor modifications and some different protocols put into place on the job sites in Boston, Cambridge, Somerville, et cetera, that by and large, that construction could have continued statewide. So our members lost some valuable time in the last couple of months. All those jobs have reopened in the last couple of weeks. And so a lot of our members have gone back to work, same for the other trades, but they are limiting the manpower on the projects to try and ensure for as much social distancing as possible, especially on the interiors of the buildings. If you think about, say, a school project, for example, once the exterior shell is up and the building is enclosed and they start doing the interior work, typically they'll start at the top floor and work their way down. So instead of having carpenters in there hanging drywall and the painters doing the taping and carpenters hanging the ceilings and guys in my union who do ceramic tile flooring, instead of having them all in there at the same time, they're trying to stagger the trades from working together so they're not on top of one another. The carpenters union and the painters union actually had pulled all their members off job sites for a couple of weeks in April as well. It was kind of strange because they pulled them off and then they sent them all back to work when we were kind of really hadn't gone past the surge yet. So it was a little perplexing, but again, I think our members by and large are a little bit more fortunate than the members of the locals that you have here on the meeting with us, the nurses, Jim with NAIDS, the firefighters, SCIU who's not in on the meeting, grocery store workers who have all been on the front lines fighting this. I would say the one main piece of legislation that the Mass Building Trades has filed that we're concerned about is because of these job shutdowns, some of the awarding authorities and the owner's project managers have threatened litigation against the contractors if the projects are not completed on time. And of course, the jobs were shut down. It was through no fault of their own. And like I said, as the jobs are coming back online, the manpower was limited to some extent. So Mass Building Trades has a bill filed to indemnify general contractors and subcontractors from being sued or fined if the projects don't get completed on the original schedule. And I'm not exactly where that's at in the legislature right now. Chrissy might actually know more about that than I do. Maybe she wants to comment.
Sure. That bill is in the Judiciary Committee right now. We actually, I believe Senator Feeney filed it in the Senate and Representative Mark in the House. What it would do, as Jim mentioned, union job sites have been a lot safer than non-union job sites. And one thing we've seen in construction is where there's union and non-union, that a lot of the non-union workers, this is no fault of their own, but their employers aren't providing them with proper gear or proper protocol. So some unions have stopped working because they don't feel safe. And this bill would protect them from, being able to be, being sued or whatever from their contractors or from their developers for not finishing a project on time out of concern for their safety.
Thank you, Chrissy. That's pretty much all I have, Jim.
Thank you so much. I appreciate it. Next in line is Donna from the Mass Nurses Association. And whoa, talk about a group that's right in the middle of this virus. We're very eager to hear what you've got to say. So thank you so much for joining us.
Thanks so much for having me, Rep. Hawkins, and nice to see you, Senator Feeney, and everyone else that has been so incredibly supportive during this crisis. I think not only nurses, and I know Paul will echo this as well, but the nursing assistants, the respiratory therapists, our physicians' assistants, we have been especially hit hard by all of this. Right from the onset of this virus, as we learned more about it, we were left unprotected with ill-fitting equipment as well as an inappropriate amount of PPE. And then to add insult to injury, the Center for Disease Control actually lowered the standards of optimal infection control by allowing for the use of bandanas for people caring for people with the COVID virus. We have fought this from day one. Part of the solution, as you all know, of that was to bring in a $410 billion grant of a Battelle cleansing machine for decontamination of masks. And we were the canaries in the coal mine immediately on that, yelling from the highest rooftops that we knew firsthand that this was a bad idea, that the decontaminations of masks that were manufactured for one-time use and disposable, that were being worn over and over and over again for up to 3 weeks at a time, losing their integrity, losing their seal, and then being brought off to be vaporized with hydrogen peroxide and then returned to the user to be reused again, exposing them even further to the virus. So fortunately, even though it took almost 2 months, the FDA has pulled that emergency authorization, but the damage for the most part has already been done. And Paul, I'm sure that you can also chime in on this, is that one of the things that we highlighted was we should have learned from the police and the fire that were at 9/11, when after 9/11 we learned of the toxic effects of that exposure. And here we were putting masks on the front line that were held tight to their face for them to breathe through for 12 to 16 hours at a time and caring for patients. And then to add injury to insult, to then be told that the virus that you acquired as a result of caring for patients was acquired in the community, that you didn't get it from your exposure at the hospital. So I thank all of you so very much for supporting the presumed occupational exposure legislation that's been filed. We need that more than ever. And just as Rep. Hawkins said, that it's absolutely unbelievable that the very people caring for patients are forced to either use their own sick time or have had to use their PTO, their personal time off, or their vacation time, or not get paid at all for not only being exposed, but coming down with the virus, and then having to care for themselves and being out of work. So we've really been put in harm's way. And when I speak for the nurses, I speak for everyone who was on the front line of this, because I don't think any of us were unscathed as a result of all of this. There was a lot of wrongdoing that we have a lot of work to do, because we're not through this. We have the risk right now of entering a second surge of this virus. And from all indications, we're going to be in the thick of it again in the fall. The fact that we still, to this day, do not have the right PPE in our hospitals, that nurses are still being forced to reuse masks and gowns, do not have the right amount of equipment at the bedside and at the ready. This makes no sense at this point in time. So that's critically important. There are two other things that I do want to bring up. One is the closure of essential services. So much has happened as we've concentrated on first the virus and now looking at the reopening. Well, back at kind of under the undercurrent that was going on was this incredible amount of closure of essential services. Hospitals that, under the guise of either saying we need the beds for potential COVID patients, or just saying, well, we don't need the service anymore because it's not revenue driving enough. So we saw the closure of pediatric and obstetrical services at Morton Hospital, only to be deemed essential by the Department of Public Health. And then, as you know, part of that planning, after something has been deemed essential by the Department of Public Health, the hospital or corporation then has to file how they intend to provide this essential service. So what they do is they say, well, no worry, we can provide this service at this hospital and that hospital. Well, fast forward a few months later, guess what? The hospital that was planned to be the response to the essential service then goes ahead and closes their maternity service as well as their pediatric service. So that same hospital, which was Toby, then put in their response to the DPH filing and finding that to be an essential service, said, not to worry, all of you expectant mothers and those parents, you can deliver your babies at Falmouth Hospital. Falmouth Hospital will be there for pediatrics and obstetrical care. Fast forward months later, we now have closed Falmouth Hospital, pediatrics and obstetrical care. So we don't know what's next in that arena, but they're not alone. The number of behavioral health beds that closed during this pandemic were astronomical, and we have more scheduled to close. Providence Hospital is scheduling to close their adolescent, child, and behavioral health unit out in Springfield. They're already taking the TVs off the wall and packing stuff up to close that essential service. And where do those patients go? Where do people go who are already traumatized, especially during this pandemic? When they're in crisis, where do they go? But they go to the emergency room, which now has already had the exposure of the COVID virus, is already looking for bed placement for people that need to be cared for during the COVID virus. And we have no beds. We have no beds to take care of people in crisis. So if that's not enough for you, I got one more, which is the actual furloughing and laying off of nurses and other essential workers. If you think my hair is on fire, I try to contain my anger, but it makes absolutely no sense. Absolutely no sense. If you think about some of what we've learned, not only from Italy and China, other states in the United States that have gone through this virus, we've learned some of things that work and some that don't work. What we do know is that if a patient is hospitalized with the COVID virus, they're very, very sick. And by very, very sick, they require the care of more than one individual. And to be laying off people that could be there to, if nothing else, be that comforting person that is with that patient that is by themselves during the most critical time of need. We have fallen. We have fallen way far from healthcare. And we are doing corporate care now, and we need to get back to being able to take care of patients. That's what we went into nursing for. And that's why I'm so grateful for everyone that steps up and says, enough's enough. Let's get us what we need and let us be able to take care of the human beings that we are. So thank you all very much.
Thanks, Donna. I actually stood with MNA when Toby Hospital
Yes,
closed the
you
maternity
did.
ward. And I wasn't, I had schedule conflicts. I would have stood with you at Morton, which is closer to me. And I'm just thinking, if a woman has a problem in childbirth, how is the next closest hospital is here in Attleboro? And that's a good 40 minutes away. What can happen in 40 minutes? And the other hospital be in Brockton. And I understand they're short-staffed and they're 40 minutes away. This is like a classic case of corporate profit having more to do with anything than serving the community. And I'm grateful for your advocacy. We've, like a lot of other things, we've got an uphill battle, but I'm grateful for your advocacy. That would just go unnoticed otherwise. So thank you so much. And thank you for the rest of, thank you for everything that all the nurses have done in the last 3 months. You go in and sit yourself right in the middle of a bunch of people that have the COVID, and you're the real heroes in this whole drama that we've been through.
If I can just expand that, it's not just the nurses, it's those healthcare workers that are in the group homes and in the long-term care facilities. There's so many other people that that are nurses. Certainly we are the registered nurses and the nurses, but there are so many other caregivers that have really gone in and done incredible work under the worst of circumstances that really need our help right now. So I'm so grateful for everyone's help and helping us get this done.
You're so right about that. Absolutely. We also had scheduled, and he sent his regrets at the last minute, was Tim Melia from UFCW, because that's another group of workers that the grocery stores had to be open so we could eat. And when I went to the store, they didn't have masks. They do now, but they didn't for a long time. So there's a lot of. That's somebody want to say something. A lot of people that were at risk in this pandemic, and we're not through the pandemic. So I'm grateful to everybody. We are 7:51. I wanted to keep it under an hour. We did that. It's perfect. We've got time. I don't see any questions. I'm very grateful to everybody in the panel for coming. We got all of you are experts and professionals, so it was very good to have this conversation with you. I'll repeat. I keep forgetting that there's other people besides the 6 of us or 7 of us that are on this. If anybody has questions, I have contact with all the panelists. My cell phone is 508-226-1436, and my email is james.hawkins@mahouse.gov. So if you do have questions tomorrow, you think of something you wish you'd ask them or want to know more about, I can get you in touch with any one of these panelists.
Jim, I can add on behalf of Tim Melia, who I was on a panel with last week along with Donna.
Well, thank you.
He was talking about some of the issues that the Stop and Shop workers have faced. He did say that the company had definitely stepped up in terms of getting the plexiglass in there, the arrows on the floors, get people so they're not walking past each other. But as far as the masks go, which you were just talking about, the company actually did not want the workers wearing masks at first because they were afraid it was going to scare away the customers. So the union really had to push back on that issue and make sure that all the employees were wearing masks. Just wanted to share that.
Oh, thank you. Thank you. I was hoping he was on because I knew that was another work segment that was certainly affected by all of this. So thank you for sharing that.
Could I add something on that too? It's worth noting that many Stop and Shop workers were able to get some of these protections, not because the company decided to be this benevolent, do-gooder, but because the union sort of forced them to. And unfortunately, I think there's a lot of workers in retail in the grocery and food service right now. Unfortunately, without the protection of a union and any real enforceable safety standards, they're not faring as well as probably some of the unionized workforce. And I think a lot of the advocacy that UFCW and others have done on behalf of all food service workers has really helped all of them across the board, whether they're union or non-union.
If I could too, I would agree with Chrissy. I mean, I think that goes across the board on everything, whether it be supermarket employees, firefighters, public safety, nurses, everyone here. I mean, if it wasn't for the unions, I think that we'd be in a lot worse situations than we are now. And I think that it's the unions that stepped up and made sure to put those protections in place, get what's needed for all the members in every workplace to make sure things are done best that they can be.
I agree. I think the unions really have set the standard going back all the way to the beginning, the standard for across the industries that have been impacted. And if I could just take a moment of personal privilege, Representative, I just would like to just acknowledge my sister Donna and my brother Paul, specifically for the work that they've been doing, because the members that they represent are the heroes we call when we're in trouble. When the heroes get in trouble, they call Donna and Paul. And I just think that should be acknowledged and thank them for that.
Well said, Jim. And Representative, I just want to, in the last few seconds here, just say, what an amazing discussion that so many people don't ever get to hear. We've been dealing with a lot of different, triage and all sorts of different issues, you and I, as legislators, since back in March. And, we tell the stories of small businesses who are getting crushed and restaurants who are trying to help out. And, you know, the Federal CARES Act with the Triple P program to keep businesses and employers going. But we don't often enough hear the stories of working people, workers, that when people in Attleboro need to get up and go to work, they get on a train driven by a worker. They, you know, get into the city that's cleaned by a worker. They walk to a building that is cleaned by a working person. They, you know, go to work and go through their day and come in contact with so many different working people. And I just think it's great that we're having this discussion and being mindful that, you know, in a time of a pandemic, not everybody is, you know, it has the same privilege and in the same boat. And there are so many working people that are literally scared to death to come home and potentially pass on a deadly virus to their family members and to their loved ones. But they have no choice. They have no choice because they have to go and make ends meet. And there isn't often enough protections for them. And then just lastly, I want to talk about our healthcare system, which, my God, we have seen is completely broken. In the midst of a pandemic, we have the leader of the nurses union who is here telling us that even in the midst of a deadly pandemic, nurses are being furloughed and laid off. I mean, what type of system do we have in this country where when we need them the most, we have, you know, decisions being made on profit to furlough and lay off workers, nurses? I just don't get that. And for, you know, for all the nurses that have been trying to do more with less and work their shifts and, you know, worried about coming home and you know, making sure that they change their scrubs before they walk in the door so that they're not transmitting a virus to their family, who have been through so much over these last few months. You know, maybe this is the moment. Maybe this is the moment where people start to listen to our nurses and listen to our frontline workers and our firefighters and our police officers and say, you know what, the system is broken. We need to fix it. And, you know, maybe it's a pandemic that gets people to stand up and notice, but we can't continue the way that we've been doing this. And, you know, this is just showing a light, really, for me, who's been working on these issues for many years. But, you know, over the last few months, it's been an eye-opening experience for me as well. So hopefully people are listening. And again, Representative Hawkins, you are an absolute champion, not only for the city of Attleboro and your district, but for working people across the Commonwealth. And I'm so glad we had this conversation tonight. It's badly needed, and I'm glad we were able to do it.
Thank you. You know, it's important to me. I come from a union background as well with the teachers. And I've been passionate that the people who are out there working should have a seat at the table. They should have some say in how things are done. In this case, when things are changing so rapidly and are going to continue, it's beyond what it ever was before. It's safety. And I'm thinking of somebody who told me that their children were afraid of them because they'd been at work and they were afraid that they'd come home with the COVID. I can't wrap my head around that. Or people sleeping in their cars because they thought they might be infected and didn't want to share it with their family. I can't even go there. That's just too much. And I'm grateful for all of you for being on this. And I've got to give credit to Jim Jones, who I run marathons, but Jim Jones has been on Zooms like since he woke up this morning, managing them. So he's doing his own kind of marathon, sitting in front of a computer screen all day. And also my legislative director, Tara Major, who organized all of this, who invited everybody and handled all the logistics. She's also been coaching me on the sideline here while we're talking as to where everything was going. She did a lot. She did all the work on this. So I'm grateful for her as well. We hit the hour, and I'm adamant that we don't go over an hour because people lose their attention span after that, and they'll never want me back again if we have a long one. So thank you, every one of you, Paul, Chrissy, Jim, Donna, Senator Feeney, all of you for your participation in this. What I'm hearing on the sidelines is that this was very well received out in the real world. A lot of positive comments coming in. So thank you all for participating.
Thank you, Rep.